Hello and welcome to the Caring Matters podcast. I'm Liz Tassone and I'm here today with Ted Bergh. Ted is the new CEO of Catholic Charities Southwestern Ohio, so welcome, Ted.
Thank you, Liz. Good to be here.
Thank you. And we're going to use this time to go over what Catholic Charities does here in Southwest Ohio, what their mission is, what programs they have available to the greater Cincinnati or Southwestern Ohio area. So you want to talk to us about your mission?
Yes, I would. We just did some strategic planning at the end of last year, and we worked our mission statement, and so I wanted to share it, and it's on the wall here behind me. So what we do is we enlighten, serve, and empower. And the first one is enlighten the community to see God's love for the poor. And the idea with that is that although we're 80 social service employees here at Catholic Charities, it's not about what we as we're not 80 social service employees. We're the larger group. We serve to have the archdiocese and the people of the archdiocese know their responsibility to help those in need. Pope Benedict XVI, in one of his encyclicals, Deus Caritas Est, said that it's your responsibility to receive the sacraments, spread the gospel, and serve the poor, and the last one's not an option. So we try to enlighten the community and get the community involved by serving the vulnerable. And that has John chapter 13, where Jesus washes the feet and then turns around and says, "You know what I've done for you, do this to everyone." So we try to get individuals involved. So we have like over 1,000 volunteers across all our programs. So it's not just about what we do, it's what we do collectively. And then the last piece here is empower God's children to rise from their spiritual material poverty. And so we don't enable people to stay in poverty. We're trying to enable people to climb out of their poverty. So it's not about keeping people poor all their lives. And so any program we do tries to help people improve their situation. And it's not just material poverty, it's spiritual poverty, because you can be very affluent, but you can be poor in your affluence. So it's both those. And so the whole model flows out of the gospel and out of Catholic social doctrine, and it's Trinitarian, Father, Son, and Spirit, and in a certain sense it evangelizes, because if you're enlightened, then you can serve, and if you serve, you can empower, and if you empower, you can be enlightened. So they all work backwards and forwards as a symbol of God the Father, Son, and Spirit. So as someone else says, we internally reflect the Spirit, body, mind, and spirit, which I think ties back into what we do in the Caregivers program.
Yeah, beautiful.
We strengthen the body, mind, and spirit.
Beautiful. And what are some of the programs specifically, aside from Caregivers Assistance Network, that Catholic Charities has available to help carry out the mission of this?
Okay, well, in the Archdiocese of Cincinnati, there's 19 counties, and Catholic Social Services of the Miami Valley does 8 counties around Dayton. We do the 11 remaining counties in the southern part of the Archdiocese, but we also do Clark, Logan, and Champaign counties, and we run a food bank there. It's like it serves 80 food pantries, and it delivers 3.6 million meals a year.
Wow.
That's about, and it works through faith-based organizations, but that's about 10,000 meals a day in that area.
Wow.
And the need is growing, and we're trying to do some things up there where we're growing that our ability to deliver food. And we're also trying to deliver more fresh food, which makes it more challenging. It's easier to store and deliver cans than it is to store and deliver fresh produce. But the state of Ohio has been improving that, and the agriculture department's been improving that, where we have more access to fresh produce that is important to get to this group.
Very good.
Yes.
Does any other programs come to mind when you think of enlighten, empower, and serve?
Well, we have a large mental health program, and that, of course, very much empowers and serves. Mm-hmm. And we have about 20 clinicians on staff, and our goal this year out of our strategic plan is we're doing around 9,000 to 9,500 clinical sessions a year. To about 1,800 patients. Our goal is to raise that to 10, or to 10,000 or 11,000 over the next 3 years.
You mentioned that you see part of your mission as kind of letting others know about how to serve, enlighten, and empower. Mm-hmm. Is there a reason that an individual would call Catholic Charities directly to make a contact, or do do you see yourself more as a referral agency, or you obviously have some direct service?
Well, we don't do much in Hamilton County. We don't do a lot of emergency services. We do have the Gift of the Magi program that we work with some other social service agencies where, and again, it's individuals. It's not so much like St. Vincent de Paul does a great job paying the rent and helping people with special needs, but we try to get involved with kind of larger needs that agencies don't fulfill. So if someone has a car breakdown and need $1,000 to get their car to keep their job, that's someplace where St. Vincent de Paul may not be able to help with that, and we try to get involved and do things like that. Or someone needs has some kind of special need to stay in school, or we don't pay tuition, but it's a special program.
Okay, so you do have some kind of emergency, you meet some emergency individual needs in addition.
We worked with Catholic Charities USA this year, and we for the Hurricane Sandy down in the New York City area, and we actually collected almost $200,000 from the Archdiocese of Cincinnati that we sent to the Hurricane Sandy victims.
Wow.
That was just a case we also worked with the tornadoes here in I think it was 2011. The tornadoes out of Moscow. We were directly involved in providing service there. We do some emergency disaster assistance.
Okay, very good. And how is it that you connect with the parishes? What's your connection with the Catholic parishes in the area?
Well, it depends. In the refugee program, we have several refugees who are at St. Leo's Parish. So we kind of work with St. Leo's Parish because a lot of the Burundis we have a refugee program that we work with the USCCB, the Catholic U.S. Catholic Bishops Organization. They have a contract with the State Department, and that contract, they're actually the largest resettlers of refugees in the country. There are several different agencies that do that, but Catholic Charities through the USCCB is the single largest one. So we bring 180 to 200 refugees, and most recently, for a while, we were bringing in Burundi refugees from Central Africa who are Catholic and who are farmers. And if you go over to St. Leo's, basically they say every square inch of arable or usable space on the parish, the farmers are now cultivating and growing vegetables.
Wonderful.
Yeah, so it's some interesting things we do.
Yeah.
We're trying to reach out to some other parishes that can. The model used to be like after the Vietnam War, when refugee families were coming over, a parish would adopt a family and kind of stay with that family.
Right.
It doesn't really work that way now and meet all the needs of the family, but we still need individuals to drive people to medical appointments, to kind of give them somebody to talk to, that community relationship, so they kind of get integrated in the community other than working with our professional staff, to be able to work with some volunteers who can kind of show them the ropes and get them into the community.
Okay.
So we're always looking for any parishes. It's not, if a parish wants to get involved in a refugee service, it's not going to be overwhelming. You're not going to have to rent the apartment and take complete care of the family, but just help the family. Be a friend to the family.
Good. So it looks like you're trying to let the parishes know how they can help you, and you in turn by providing support, like family caregiver support groups and so on, are trying to enhance their programs as well.
Mm-hmm.
Yeah, very good.
I wanted to go back to the mental health services.
Yeah.
Because people say, that's not for me. But our mental health services, we help individuals deal with stress. We help them with relationships. We help them with addiction, and we help them with behavior. If children are having a hard time, if children are being bullied, or if children are not, we can help children adjust. If there's some kind of addictive behavior, it's multiple kinds of addictive behavior, we can help individuals overcome that. If there's relationship issues in families, or it's not so much marriage counseling, but if there's some relationship issues in families, there are a whole list of things that our clinicians are able to do, and they're mostly master level mental health therapists.
Okay.
So there shouldn't be a stigma attached to that. I kind of think that almost every one of us at some point in our lives would benefit from some mental health work. Mm-hmm. And I know there's some members of my family who have gone out and gotten some mental health assistance, and it's made a big difference for them.
That brings up a question in my mind, and that is, do you have to be Catholic to contact Catholic Charities to get help?
That's a good question, Liz. Thank you. Because we serve all faiths. We don't serve Catholics. We serve because we are Catholic.
Wow, very good.
And although Catholic Charities itself, of our 80 employees, I think more than half are not Catholic. So, but the Catholic mission is clearly there.
Okay.
And no, we serve all kinds, and we're not proselytizing. Although when we do things like mental health, we kind of keep a faith-based in that, your faith is important in that, but we don't say, oh, you have to be Catholic or anything.
Right. Just has a faith-based core to it.
Yes, it absolutely does.
Yeah, which I believe in mental health could be helping it to sustain throughout their life too.
Yes.
Not just tools for that, but building their faith that supports them throughout their lives.
Yes.
So, very good. Is there anything else you want to talk about?
Oh, well, we also have the SUCASA program, which we work a lot with immigrants and migrant workers who come to this country looking for employment and come to this country looking to basically they send a lot of money back to their families, because we had the Bishop Ramazzini come here who spoke at our banquet last year. He came from Guatemala, and he said, you can come into a twinning relationship in my country, but you don't have to come all the way to Guatemala to help the poor, because the poor from Guatemala have come to you looking for a way to support their families.
Wow.
And so we make a very big emphasis of helping the immigrant families here. Just the way 100 years ago, my family immigrated here 100 years ago, both sides of my family, Polish and Swedish. And so, they needed help assimilating, and this latest group of immigrants needs help assimilating. So we help them in all kinds of ways. And that kind of case, we're kind of generalists, not specialists.
Yeah.
And there's English as a second language, GED, and to our experience, these are hardworking individuals that just want to do things to help their families.
Very good. So you don't have to get on an airplane to serve the poor. You can do it right here in your backyard.
You can do it in Carthage at SUCASA.
Yeah, very good. Very good. Anything else you want to bring up before we close out?
Well, just that we have our family program, we have our senior program, and we have we do a senior companions program. We have a foster grandparents program, and we have an RSVP program. So if there's any seniors who want to volunteer, those are all ways to get involved. You can call us and or go on our website. And then we also have we do some family, how to have a better family, how to create a better family. We actually have some contracts with some county agencies that there are very troubled families who maybe have lost their children to the foster care system. We help those families kind of pull it back together so they can retrieve their children from the foster care system. That's the extreme side, but with that kind of expertise, we just do generally how to be a better parent, how to have a better family.
Yeah, just develop skills that help the families know how to deal with just the everyday issues of raising a child.
Yes.
Yeah, very good. Very good. Well, thanks, Ted. You obviously have a lot of excitement and enthusiasm for what you're doing here.
Yes, it's a great group. We do great work, and I'm happy to be with this group of individuals and the whole community that we serve.
Very good. Well, I'm Liz Tassone. I want to thank you for listening. I want to thank Ted Bergh, the new CEO here at Catholic Charities, and always remember that caring matters.